Everyone. It's good to be with y'all. And sorry, I was muted for a second there. But yeah, it's just that things have been so different lately with everything going on with the pandemic. And I just feel like it's been exceptionally hard for med students to find like opportunities to shadow, do observerships or electives or even AIs. And I think that really just is like hard to figure out exactly what you want to do. So I'm really excited that I can help y'all with this. And if anybody's interested in family medicine, I'm here to convince you why. And then yeah, just a little bit about myself. I'm a family medicine resident. I'm actually an IMG, so pardon me if some of you feel like you can't relate. But I've been mentoring students for quite a few years, have been part of a lot of like institutions where I've been part of academic roles in research, and just been trying to help med students honestly all over the world. So yeah, I'm glad, Shannon, that family medicine is definitely a goal for you, which is great. I did put together a slideshow, and I was telling these girls earlier, it is really just, it's just, I put it together as one of my patients no-showed in clinic today. So it's just some of my thoughts that I put together really. Let's see if I can share that with y'all. Okay, so, okay. Great. Okay, yeah, I think that worked. So, I hope you all can see this. Just don't want to keep going if you guys.
Yes, we can.
Okay, wonderful. Okay, so it's just lighthearted, easy conversation, things that I thought that you guys might be interested in. So, I am a family medicine resident at Baylor University Medical Center in Dallas. This place is definitely my first choice. I know it's like that weird question, just a little bit about myself. But I basically grew up in Pakistan, in Karachi. It's a tiny coastal, but also like a giant metropolis, kind of a city. And then I did all my schooling, my college, my med school in Pakistan. And then I moved to the United States in 2016. So when I was doing my med school, I was pretty interested in research, and that was something that was lacking in my experience. And so most summers I would take a research elective, places where I just thought that, maybe I would see myself being. So I mostly in New York. So I did a lot of research stuff with a bunch of really good universities there. And like I did a neurosurgery research elective at Weill Cornell, and then I did a bunch at Mount Sinai, and one at SUNY, and they were definitely hard to find, and they were a little bit.
I was 18 from India, and then I went.
And then, so yeah, and so I was constantly aware that that was something that I was most interested in, and I wanted my practice to be extremely up to date, and I wanted evidence-based practice whenever I did practice, and so I just wanted constantly to be a part of that. So that was great because it gave me an idea of really what I wanted to do, because most of my med school experience, I was really unsure. I kept flipping, flopping between surgery, between maybe doing cardiology, maybe doing oncology. So there was a lot that I constantly kept wanting to do, but I just couldn't figure it out. So this whole time I'm doing research stuff. And then finally, one of the places that I had worked the most with, and it was in surgery. And then I was able to get a job there as a clinical coordinator for like one of their massive research trials, which was great because that's exactly what I wanted to do. And at that point, I wasn't sure if the right residency was something that I had yet figured out. So things were really unclear. So I moved to New York pursuing this job, and things were going great. And then I met my significant other, and he was a born and raised Texan. So that's how I moved to Texas. And this is 2016. So a couple of years later, people were like, so what are you doing? And then that's when the true desire to really, okay, well, now I just really do want to practice medicine. And so when I moved to Texas here, I was like looking for the best places that I could practice. And so I literally went online and I was like, best hospitals in Texas. And then I found Baylor, and I was like, you know what? I want to go and I want to work there and I want to figure out how things run. And so I started, reaching out to people, started sending my resumes. And it was like a huge struggle. It was honestly a very stressful time for me. I was like super anxious because I wasn't hearing friendly beginning, particularly love IMGs that much. So I just wasn't getting a response until I finally picked up a research place at Baylor, and I started doing cardiovascular research there. And so now at this point, I am all over the place. I've done neuro for a bunch of years. I've done cardiology now for 2 years. I've done surgery. I have no idea what I'm doing. And so for my residency match, believe it or not, I'm going to be super candid, I applied for internal medicine, family medicine, and surgery. And I was like, these are the things I'm really interested in, and I seriously can't decide. So I'm just going to go ahead and apply everywhere. And then when I actually started going over for all the interviews, and thankfully at the time I physically had to go, unlike all these virtual visits now, because honestly, they're so difficult for you to understand what the people are like, what the place is like, if you're going to want to work there forever. But when I went for my interview trail, that's when I realized that I honestly enjoyed family medicine so very much. And like the Baylor Family Medicine program that I interviewed at, I made sure that the places that were my top priorities, I made sure to do an AI if I could. So I auditioned there for a while, for like a couple of weeks. And that's definitely something that I recommend for everybody. If there are places that you think that you definitely see yourself being, in terms of what your scores are like, in terms of if you have family, whatever your requirements are, they they accommodate you too, based on those based on what you really care for too. So if something is your top priority, definitely reach out to the program coordinators, definitely ask them, say, hey, I want to spend some time with you guys because I don't know what I want to do. And so that's exactly what I did. And that was just great. It was fabulous. I spent like 2 weeks with these guys, and I fell in love with the concept of being the first one that a patient would come up to, because working in specialties really just gives you this tunnel vision of what you can treat your patients with, or how you can help them. And then when I worked as a family practitioner, I felt like there was so much that I had been missing all these years, and that kept like kind of getting pushed under the rug when you're working in a specialty, or even surgery, because you don't get to do those interactions, you don't get to meet with your patients, you don't get to see their families, you don't get to have a moment with them and talk to them, and then just kind of get to know them better. And I was embarrassed that I had never gotten that experience before, and that I had never sought that before, which honestly, I regretted at the time. I'm like, I spent all these years, and then I just missed all of that. And so it was a great experience for me. I loved it. And so I ranked that place my top priority. And a lot of the places that I ranked or I interviewed at, like I said, I made sure that um, I auditioned there. Even if they didn't have an audition position, I reached out to the coordinator and I said, hey, I just want to hang out with you guys for a day and see how things go. And I remember there was another place that I interviewed at and I couldn't get an audition, which was one of my top priorities. And so I just got a day with the residents. And everybody was great, super nice. It was actually one of my top programs, but the residents were so unhappy. And there was this trend where, like the the second years or the upper levels or the third years, they would just kind of, I won't say bully, but they would ask questions or they would just unnecessarily pimp the interns. And I just felt like, man, if I was in this position, I would literally just be crying and running out the door. Like, this is not the place for me. And I noticed the same thing with the attendings too. So yeah, and I just felt like, I'm probably not even going to rank this place. And so that's what I did. And so definitely that gives you a very good idea of what the places are like, not based on what they look like on paper or on their website. Physically going there matters a lot. So yeah, and so after that, I did rank the family medicine program as my top one. And as crazy as that sounds, I did miss out a lot of the programs. I didn't even rank a lot of the programs that I interviewed at because I just felt like, God forbid they chose me and I ended up there, I would be so unhappy. And so so that kind of stuff definitely stuck with me. And whenever I try to like mentor med students, I always tell them, like, you know what, you're gonna get there somehow or the other. You can choose to be unhappy for like 4 years or 3 years, or you can choose to actually enjoy that experience. So definitely look into that for sure. But yeah, so that's a little bit about my academics. I know a bunch of you asked what kind of research opportunities are there in family medicine, and I'll get to that one for sure. But I definitely want to incorporate research into my career. In fact, right now I'm part of 5 different studies that I'm the primary investigator for. And as crazy as that sounds, I just do find the time to do those. I'm part of a COVID study right now. And so all of those things definitely are things that matter to me. So if there's something that you really care about, you can definitely incorporate that in your residency schedule. So yeah, let's go ahead a little bit further. So a little bit about what family docs do. So this is something that I honestly learned as I started doing this residency and I started interacting with a lot of my attendings, a lot of the people who practice such amazing, practice, and their, patients actually love them. So I found this from literally the American Board of Family Medicine website. And these are some of the principal key like responsibilities or core values for a family practitioner. And I just thought that it's pretty interesting to think about them instead of just saying, okay, yeah, I guess family medicine doctors do everything, but you're caring for your patients regardless of age or health condition. And then this is definitely one of the most satisfying or the most rewarding thing is when you endure and have a trusting relationship with them. Because several of my patients, so from the beginning, from the first year of residency, you start to have a clinic schedule. And definitely family medicine is very clinic heavy. So we have like a day and a half of clinic every week, and that's your schedule. So you get to see those patients as you progress through your residency as well. And then when that happens, you do develop like this relationship with your patients. They bring their families over, they talk to you about their friends, and they're like, I know someone, and like right now, for instance, I have a patient, I have a patient, she was pregnant when she came to see me. And she was like, I just never had a family doc. And I thought I had, this was the time to get one. And I was like, great, I'm more than happy to take care of you. And I did. And now she had a baby, and now we're taking care of the baby. And it was just the most amazing, the most satisfying, it made my day when I saw that baby. And so she's like, yeah, because I never had a family doctor, and I wanted my baby to have a family doctor. And I thought that was just amazing. And I never realized that feeling before, but it's awesome. So yeah, that was cool. And then the other thing that I realized very hardcore during this pandemic was you are the first contact. So when patients are going through anything, like even right now when they weren't feeling sick and they had to get a COVID test, the first thing you do is you reach out to your PCP. And I just felt like there's an immense amount of burden that comes with that task or responsibility, because patients definitely reach out to you at the first moment that they start feeling sick, and then it's up to you to kind of take them on that whole process of, hey, I think you need to get this test, hey, maybe I think you need to go see a specialist. It's up to you to navigate their healthcare system, basically, which I think is a huge responsibility that a lot of the family medicine doctors don't talk about particularly. And they always, yes, of course, we take care of a lot of other medical concerns, but the fact that we are responsible for navigating their care is definitely very, very rewarding, because if you do it right, it's essential for their health. So that's definitely something that, right now with the pandemic, we're so essential. And then after they get COVID, the follow-up after, and then the release to work excuse and all that stuff, that's a lot of work, but it's definitely something that's very important. And then the questions here about family medicine to internal medicine. So family medicine to internal medicine, the only difference is that family medicine will see OB and pediatrics. So as opposed to internal medicine family practitioners, they're only adults because they don't get any training in peds and OB, while a lot of family medicine programs are very OB heavy. So maybe 30% of your program would be spent doing OB, or even 50%. And there's a lot of peds heavy too. So we have a peds outpatient clinic, we do peds inpatient, we do peds ER. So OB is obstetrics and gynecology. So so that's a huge part of family medicine too. So yeah, definitely that's something that really gives us an edge. And then other than that, with the pandemic, a lot of the telemedicine visits are also a lot easier, and it kind of gives you the opportunity to see more patients at the same time. And then, however, I do feel that sometimes the need for them to come in is definitely transcends over the fact that, you can send them a Z-Pack over telemedicine visit. So I've struggled with that. I have had patients who have called me over the phone and who have told me like, hey, I think I have oral thrush, and I've had that before, and this feels exactly like that. And they've been they're sitting outside in the car while they're having this video chat with me, and I'm just like, I'm not convinced. So I literally been like, you know what, I'm just gonna come to your car and I'm gonna take a look in your mouth, because I can't prescribe you medication that I just don't feel convinced for the diagnosis. And though I've literally just rushed into a patient's car, put a freaking torch down her throat, and like taken a look at it while I'm wearing all my PPE, and I've been like, this is not thrush, like you're having strep. So like the treatment would have been completely different if I kept giving her antifungals. So definitely one of those experiences where it's my discretion, and my attendings who've been in the clinic have been like, are you sure you want to do this? Like, it's up to you. We don't want to put you in the way of this. Like, we don't want you to see her if you think she has symptoms. And I'm like, man, I can't give her antifungals if she has like strep right now, So those things keep happening every now and then, and those things definitely make you feel like it's up to you to like really how much you want to care about your patients, or how much you want to risk based on your risk factors for exposure. But it's been interesting to work in this pandemic with all of these things happening and evolving every day. So that's been interesting. And so yeah, other than that, so those are some of the tasks. And then another thing that I particularly really enjoy is the community level, factors and social determinants of health that we're constantly put to a face. So I particularly grew up in a third world country, and I did not feel like, I had all this freedom to order unnecessary tests, or even just tests to like get a baseline for a patient, or order imaging sometimes, because everybody who came to our clinics at the time were really, really poor. And so growing up in that environment, I think definitely made me more aware. But when I started working here, and I think that that's not Texas, or that's not just about Dallas, but most part of America also has a lot of discrepancy on based on the socioeconomic factor too. So have a community, just an uninsured community, really poor rural community, rural clinics that we do once a week. And then we have a really high-end suburban insured, like older people, more like geriatric based clinic in one of the suburbs in Dallas too. So when I started working in both of these places, the contrast of having to deal with someone who is uninsured, who's jobless, who probably doesn't have any social support, and they're coming to you with, because of their social determinants, they're coming to you with uncontrolled diabetes, uncontrolled heart diseases, obesity, metabolic diseases, cholesterol, all of that stuff. And you go in a room and it's 7 things that they would just talk to you about, instead of maybe just that one, like I have a fungal infection in my toe. So that discrepancy in medicine is really what just breaks my heart every day, and yet makes me so humble. And I feel like if I hadn't chosen family medicine, I probably would have never experienced that. So again, like every day I am put in that situation. And yes, it is very, very difficult to navigate, Vivi. It's been one of the hardest things that I've had to deal with for sure. And yet, being in America, you're privileged because there are tons of opportunities for you to find help for these people. So there are a lot of like charity clinics like ours, and we have tons of donors who give us very generous donations. Like right now, someone gave us a whole bunch of diabetic boots and shoes that have been really helpful for a lot of our population. We get tons of medications, like we get all the diabetes medication, insulin, metformin, we get all the hypertension, we get all the blood thinners, which are extremely expensive. They're all completely free of cost. And so a lot of the times that becomes your responsibility, because you can for sure send insulin to a patient that has diabetes, but if you didn't follow up on it, then they would probably stop taking it, and just how they never did before, and then they would come back the next minute. So what's truly important for you, even especially as you guys are all younger, about to start your journeys, is to establish that kind of compassion and empathy in your heart, and to say, hey, this was my dad, and he came in with an hemoglobin A1C of 13, which means his diabetes is through the roof. And I'm sending him home with insulin. I need for him to have a very strict follow-up. And, some of these people don't have cars. So our clinic would actually provide transportation for them to come be picked up from their place and be brought here. And then also for you to physically be involved in their well-being. And so as a doctor, I have as their doctor, their primary care doctors, I have called them on weekends 2 weeks later and been like, hey, what has your blood glucose levels been like? You didn't tell me. Or is there anything new going on with you? And right now, and I don't know if this is something that's just new, because um, a lot of our poor population, um, and these rural communities do experience definitely a higher number of stress and anxiety. But given the pandemic, it's been like that even in the urban population a lot. And so all of these conversations somehow or the other have led to a depression talk, where people have been laid off, people have been struggling with providing for their families. People have been struggling with a lot of built up depression, anxiety, social domestic abuse. All these factors right now are running rampant in the society, and it becomes essential for you to have this level of intimacy with your patients, where you're like, hey, you're not looking good, what's going on? And the next minute, there's like waterfalls all over the place. And I have physically mentored a bunch of my patients. I have tutored them, I've helped them get their GED so they can find jobs. And so these are the think about. So, and I'm constantly told by my attendings, and I'm constantly told by people who I work with or my upper level saying, hey, this is, are you sure you want to start this? And then oftentimes there are other people who I've reached out to. So there are definitely people I've been like, hey, you're part of a community center, and like, right now there are no classes going on, but she has another job. This patient of mine is super motivated to like help feed her kids. She's divorced at this point, blah blah blah. Like, can we help her? And they will find it. So it is essential that you took those steps. You made sure that your patient's well-being, physical, mental, and emotional well-being is being taken care of. And I can't emphasize this enough. Being family practitioners, that is one of your biggest responsibility. So if you're the kind of person who right now, as I'm talking, is feeling like this is too much, that you are not comfortable being that person, then maybe this field is not for you. Because everybody deserves an opportunity to go to someone and talk. And if you can't, then if you feel like you can't let your patients be upfront, honest with you, constantly be your family, then I think it becomes really hard, because they won't be honest with you. There will be a lot of things that will be lost to follow up, lost in conversation, lost in translation, where you just feel like there's something going on and you won't find them, their help will deteriorate. So those are things that definitely family medicine teaches you. And it really pushes you to be more compassionate towards people. So for sure, that's definitely something that I'm learning, constantly struggling with. There are days when I literally can't even just pull myself together. I will see 5 patients, and then I will literally just have to go talk to my attending for an hour about what I want to do for them. And it's hard sometimes, and it's time consuming with families and lives that we have. But if you didn't do that, then nobody would, because this patient is probably not going to see a specialist. This patient's put off seeing a primary care doctor for years. So this is your only chance. So always keep in mind when you're choosing specialties, based on how and where you want to see your life and yourself going. So I always recommend that. And then I definitely feel like I learned more interpersonal skills as I grew older and wiser during my residency experience. I have attendings who are amazing human beings, and they are part of like community community shelters. They practice tons of homeless medicine, street medicine, and they also are constantly, helping their patients out on a personal level. And so I definitely learned that from them. And I definitely also sought them, even when they weren't meant to be my attending. Whenever I had a moment, I would just hang out with them and I would talk to them about the social determinants of inequality or inequity in medicine, because it is so pertinent that you are aware of that leaving your residency, that that African American population has historically struggled with health issues, or that Hispanic population is likely at a higher risk. Being Hispanic is already a risk factor for a lot of the diseases, just because they are definitely not giving a lot of attention to their health, or their hard workers, or their construction workers. Those kind of things are definitely something that you need to learn as you finish your residency, because once you're in the hustle and bustle of running a clinic, which is so fast paced, there's going to be no time for you to take a couple of moments out of your busy schedule and looking into this. So definitely very liberating experience, very gratifying, and it humbles you. And so that's how I felt about it. So let's see some other perks. So a bunch of you had asked earlier too about work-life balance. So family medicine overall, in my opinion, has an amazing work-life balance. Most of our rotations that we do usually end within, like, I would say, like a 14-hour day, which seems a lot, yes, but it's not as terrible as it sounds. A lot earlier. So all the hospital rotations will usually start by like 5 a.m. or 6 a.m. and you're home by like 5 or 6 or even 7 at the most, which I think is pretty good because I can come home, I have a bunch of hours. And then you'll have, every now and then you will have some night floats or night rotations where you're just working overnight, but then you will have plenty of sleep to work at it. The ACGME over the last couple years has particularly put a lot of time, attention, and detail into making sure that your time frame for your work hours are definitely under 80 hours. And I honestly, on my busiest rotation, have probably worked like 70 hours in a week. So it's not as terrible. Once you finish residency, because residency historically is known to suck. So I'm not even going to, sugarcoat that. So once you're done with residency, then if you're working in an outpatient environment where you run your clinic, you have all of this freedom to choose your hours, where you can work 9 to 5, 5 days a week, or you can work 3 days a week. So a lot of my attendings who I've actually become great fans of, they're part-time family practitioners. They practice part-time because they have kids and families, and I think that they definitely feel like it is very doable, as opposed to some of the other very, very demanding specialties where you can't so much take a time like that, say, hey, I'm only going to work 3 days a week, because it will take away your patient load, it will take away a lot of the big procedures from you, you won't get the same amount of work, and then eventually your salary would suffer, and it would be very socioeconomic like fallback on your part, as opposed to family medicine. Your base is your patient load, and so definitely if you have a stable patient load, or a stable amount of patients who you see and follow up with, they're never going to go anywhere. So it's definitely very, very doable. And like I said before, family practitioners are always needed, especially the way that our insurance systems are made here in America. You can't even get a referral to a specialist without seeing a family practitioner. So we're never going anywhere. In fact, one of the 2017 All Physicians Academy, or like the ACPA Academy poll, said that there was an increase in family medicine demand by like 28% over the last couple of years, because a lot of the younger folks just weren't feeling like enthused about it, and they didn't want to do it as much, but not realizing that the demand had really been increasing. So mine is the rural population, even the urban population, the family medicine attendings or consultants or concierge family practitioners, those demands are through the roof right now. And like I said earlier, even with COVID, the demand for family practitioners has increased significantly. You are required to see your family practitioner to get to back to work excuse letter. We are the ones dealing with ordering those testing for them, making sure that they know exactly what's going on, giving them quarantine instructions, giving them supportive care instructions, taking care of their family, whoever gets infected. And then there is such a thing where once you do get admitted in the hospital, the post-admission discharge follow-up automatically goes to your PCP. So after a patient has been admitted in the hospital for whatever reason, they are required to follow up with a PCP for that continuity of care. And so I definitely feel like there's a huge demand. And then definitely I feel like this field of medicine has grown. Suhani, I think that there are things that we could improve on, which depends on a personal level. For instance, a lot of the residency programs in family medicine are now really focusing on point of care ultrasound for family practitioners to learn. So if you're practicing in a rural area and your patient comes in with some sort of a like maybe a kidney stone, or they're pregnant and they don't know, but they're really decompensating in front of you, if you can learn point of care ultrasound as a family practitioner, you're able to do that ultrasound right there and then and figure out what's going on. In fact, last week I had a patient in one of my clinics, and this wasn't mine, it was one of my other co-residence patient, and she was completely asymptomatic. She came in with complaints of on and off constipation. Her BMI was pretty high. She said that was baseline for her. She's always been a big girl. And then my co-resident, who's exceptionally smart, was like, I don't know, there's something wrong. There's something about your stomach, just doesn't look great. And he ultrasounded her, and there was a massive ovarian carcinoma that was growing in her belly. And she had to get it resected. It was humongous, and it was actually talked at the cancer boards, which was just so fabulous. I was so proud of my co-resident. But these are things that you pick up all the time. I've picked up pregnancies in my clinic that patients had no idea, just from doing point of care ultrasound. I've picked up hepatic cyst. I've picked up thyroid issues, thyroid nodules, breast cancers. I picked up breast cysts, breast carcinomas. So definitely skills that are evolving. And like I said, things that definitely you can think of and you can do. There is no such thing as, hey, I'm just a family doc, I'm not going to do that. You need to say, this is a skill that would really help me build my career, and you need to incorporate it. So stuff like that definitely works along with your program director, where you're practicing, and eventually where you want to practice too. And what kind of medicine you want to practice. If you want to practice underserved medicine versus urban medicine. So all of these factors definitely come in handy. And so one of the other perks about family medicine is that it is a fairly well compensated field too. I think one of the starting salaries for residents, like literally graduating, is $250,000, which I think is very well compensated, because in the past, I think in the last couple of years, this has increased significantly. So a bunch of our residency graduates who graduated now have started jobs like that, which is great. And that is for Texas. Yes, that is for Texas. And I believe it's not the highest paying either. So there are other states they're paying a lot more. So it's risen a lot. The salaries have increased a lot, and I think that's kind of goes to show how much family practitioners are needed. So they're trying to fill the gap, and they're trying to pay us more. So definitely feel like it's super well compensated. And then the opportunities to evolve. So there are tons of things that you can do. So based on what you want to do, you can always choose to have a great, run-of-the-mill outpatient practice where you see your patients like 5 days a week, 3 days a week. It's a 9 to 5 practice. You can also do a hospitalist job where you're working in the hospital and seeing patients in the hospital. You can do tons of fellowship and get, specialized. You can work in the ER. And I actually personally really enjoyed that. So working in the ER or in urgent care, that's definitely an option for us. So all of those things, there are definitely a lot of opportunities to evolve. There are a lot of academic opportunities for family practitioners. A lot of our lecturers, a lot of our professors are family practitioner doctors. There are a lot of opportunities to be a part of leadership roles where you are tutoring and mentoring students. So there are definitely a lot of opportunities for people based on what they want to do. There are tons of research opportunities, tons and tons of research opportunities. And like I said earlier, I had a really strong background in research, and I felt like I just really was constantly wanting to practice in evidence-based medicine, and I felt like research, if I just wasn't a part of it, I would never know what was going on. So I think my first month that I started my residency, I reached out to the research department and I said, hey, what are some of the studies going on? I want to be part of them. And then there were tons of studies going on, and they let me know. And I'm part of 6 trials at this point. And then when COVID started, I wanted to look into some of the resident well-being and all the stress factors, and I created my own study. So definitely working with institutions during your residency gives you a lot more opportunity to practice research. And then as you graduate, you can take that to other academic institutions and continue to practice research if that's what you want to. And then let me see a few questions. Whether you feel limited in any way, like you always refer a patient out. So that's a really good question. So prescriptions that I can write, I personally would not treat a leukemia patient because, like I said again, Everin, a lot of the other specialties are constantly evolving. That goes beyond saying for oncology, hematology, rheumatology. The treatment options are fairly new. They're coming up and about. And as much as I want to stay up to date, I don't know I would be doing my patient a service by prescribing something that was no longer like the grade 1 recommendation. And so for patients who are super subspecialties or oncology, definitely I refer them out. And I never ever hesitate to talk to them about my reservations and say, hey, the last time I studied oncology, I think we were using that medication. I want you to get the best care. So I'm not going to prescribe you something that I studied 3 years ago. I unfortunately don't have the time to do that. And so I will definitely send you over to a specialist. And I think, I have had these conversations with my patients repeatedly, and they respect my decision to do that. I have also had interactions with my patients where they have come to me saying, hey, when I was in the hospital, they told me I had CHF and it was an exacerbation. And they said, I need to follow up with a cardiologist. Can you refer me to a cardiologist? And I looked at her and I said, hey, I think I can manage CHF pretty well. I think I'm good. And so I've taken care of her chronic CHF. I've taken care of hypertension, hyperlipidemia, all kinds of heart disease, and never blinked an eye where it's like, I don't think you need a cardiologist. I have gotten stress tests for my patients, which have come out positive. And then I'm like, hey, I need you to go see an interventionalist and get a PCI, because unfortunately, I'm not going to be standing in a heart cath doing your heart catheterization. So these are restrictions. I wouldn't even call them restrictions. I would just say these are, things that you personally need to be comfortable talking to your patients about. You need to be comfortable in understanding your own, your own limitations, your own things that you're great at, and you need to be able to talk to your patients about that and say, hey, I'm not great at leukemia treatment, so I'm sorry I can't help you, but I'm great with heart failure, so I will be monitoring your echocardiogram yearly since you're getting radiation therapy. So that's the thing. And there's no guilt or shame in recommending or referring your patients out to specialists, because that is one of your responsibilities, to get them the best care possible. So being honest with your patients, Alexa, yes, it is so necessary. It's not even necessary, it's just absolutely it's just a staple. You can't just get out of it. That's one of your responsibilities. So definitely, yeah, be honest with your patients, know your limitations. A lot of the times, like, I've even had my patients come up to me and talk to me about things like a skin rash. And I'm like, oh my God, I just can't figure it out. Like, I don't know what this is. And so I've like reached out to my attendings, and I've reached out to my fellow co-residents and been like, hey, can you come take a look at this rash? Because I'm like not sure. And then they've taken a look at it and they're like, oh, it's this or it's that. So there's ongoing discussion with your other co-residents, your other faculty members. And then it definitely helps a lot to stay humble and to just, this is a whole learning process. So there's never going to be a moment or time and space where you're going to know everything. That's going to be impossible. Even though there is nothing wrong with them and just want to get a checkup. Yeah, absolutely. So all insurance companies cover the annual wellness visit, which is, in my opinion, the most crucial and essential visit that everybody needs to do once a year, where they get labs drawn, they get a yearly physical. I, for one, am all for it, and I have bullied a lot of my friends, family, neighbors to come do that. And trust me, a really close friend of mine had never seen a family practitioner, never seen a doctor before, right? And so he's like, yeah, I know I have insurance. My insurance covers for one-time visit and blood work. And I'm like, yeah, you need to come see, me or someone. And so he comes to our practice and would see one of my attendings. And, it was great that we were able to see him, because we drew his blood work and he had hyperthyroidism that he had no idea about. And he didn't even have that many complaints. His just complaint was like weight loss. That was kind of unintentional, but he was like, yeah, I got COVID earlier, maybe I wasn't feeling well, yeah, I lost like 30 pounds. And I'm like, 30 pounds? That's not normal. And he was like, I'm feeling great about myself. I'm like, yeah, but that's not normal. So yeah, his thyroid was out of whack, and he had a crazy thyroid history too in his family that he completely forgot about. So stuff like that definitely goes unnoticed. Or I've picked up my patients who come in with long QT syndromes. We picked up patients with congenital heart disease several times, because they've just come in and it's like, there's a murmur. Did you know there was a murmur? I don't know. I'm like 17 years old. I've never seen a doctor since I was a baby. And so definitely, it's great. I would recommend everyone to go see their PCP right now. And then, so family and friends. So family and friends, it's never a good idea to treat your family and friends. I have definitely bullied a lot of my friends and family to come see a PCP in our practice, but I've never been their doctor physically. And I think it's, I'm not sure if it's illegal for family for sure, but it's definitely unethical, and it's also just uncomfortable. So definitely I don't see my family and friends or don't send any prescriptions for them. And that's why I really make sure that they're established with the family practitioner. So when they need their prescriptions, they're bullying me about it, saying, hey, can you send me a Z-Pack? I'm like, dude, just call your PCP. So it's definitely good when they have appointments with the PCP already, or they have established care with the PCP. So yeah, definitely don't recommend doing that. Other than that, for the family medicine residency overall, so there are tracks too that you can take. So for instance, one of our other co-residents in my program, she's great, she's amazing. She's super interested in homeless medicine or street medicine. So she came up with a street medicine track during residency where she spent a lot of time, a lot of elective time, just, seeing homeless patients and caring for them. And that's what she wants to do when she graduates. And then another one of my co-residents made an ultrasound, a point of care ultrasound track. And so he's finishing modules for that. So when he leaves or when he finishes his residency, he's able to really read ultrasounds and do ultrasounds on all his patients if he cares, So those are things that you can definitely talk to your program coordinator about, or you can choose a lot of the programs that already have these tracks, because I believe homeless medicine or sleep medicine tracks, addiction medicine tracks, adolescent medicine tracks, women medicine tracks, preventive cardiology tracks, all of those exist for family medicine. There are tons programs that have those tracks, or rural medicine or underserved medicine. I particularly did not create my own track because I thought for the longest time that I was really interested in cardiology, and I had spoken to my program director about it, and I said, hey, I want to do preventive cardiology track, and he was all for it. But as I started practicing as a family practitioner, I realized that I didn't need a track to help my patients with cardiology, just given that I was interested in it and I was pretty good and comfortable treating my patients with their cardiology issues and concerns. And so I was just like, you know what? I don't want to spend another 5 months doing cardiology. I think I already know enough. And I went up to my program director and I told him that, and he completely agreed. He said, yeah, absolutely. I knew that, but I just didn't want to say that. And I was like, yeah, so there are stuff that you feel like that you're super interested in. Sports medicine is a great track for family medicine. I know one of our co-residents is doing sports medicine. That's very, very important because a lot of the sports injuries come to us all the time. So that's definitely a great track for a lot of the people out there. And it's very interesting too. So yeah, those are some of the opportunities that you can do either throughout your residency. Tracks are something that you add during your residency, with maybe adding in an additional couple of months, or even while you're doing it, to put your elective time in it. And that really helps you, give you some extra certifications, get you some extra experience. So when you graduate, you feel more comfortable dealing with those kind of patients, particularly if that's your interest. Like if my friend wants to see, at some point, he says, I'm only going to see sports medicine injuries. That's basically his specialty at that point. So that would be great, because a lot of those things you learn from experience. So the more you practice, the more comfortable you are. And then the more, confident you feel about your skills and about your ability to diagnose patients. Definitely helps a lot. And then real quick, I did put together some fellowships for family medicine options. There are tons of fellowships that are available for family medicine. I, for one, have not been able to figure out which fellowship I want to do. I am extremely interested in palliative care and hospice. And so maybe at one point I will take up that fellowship. It's only a year, and just kind of spend that year doing that, and maybe just be a palliative care doctor. But for now, I enjoy all of these aspects of medicine. And just FYI, each one of these fields are things that are already part of your family medicine program. So once you graduate, it's not that you are not feeling comfortable dealing with either of these situations. You will definitely just be more well-versed and experienced if you did a fellowship. So these are all great, great, great options. You can do 2 fellowships if you wanted. Yeah, sure. Do as many as you want. You know, their preventive medicine is great. Pain management is great. Yeah, maternity care and obstetrics, one of the very, very popular ones. And I always stress on this because the OB and the GYNs who will be, you know, taking care of these patients particularly don't end up seeing the babies. So you could definitely take over the babies too. So it's like a whole, like, you take care of the mom while she's pregnant, then you take care of the baby too. So it's like you're taking care of the whole family. It's wonderful. So yeah, tons of other opportunities for fellowships. And yeah, you know, that was all I got. I will see if I can answer a bunch of questions. I know I missed a ton of questions. You all had just amazing questions here. How do you deal with uninsured patients? The way you help and treat uninsured patients definitely changes a lot because you have to worry about finding them the most cost-effective medication plan and something that they can stick with. So it's definitely very, very hard, but you try to get the best help and you try to work with a lot of the city organizations who can provide you cheap medications to help them and treat them. Okay, well, I think our time is up unless y'all want me to keep going because I'm happy to answer some of these questions.
Thank you so much, Dr. Badar. This was absolutely amazing. Yeah, there were a ton of questions and you answered a lot of them throughout, but I think one of the more commonly asked ones at the beginning was kind of about your experience as an IMG. I think we have some international students that were like talking in the chat. So I just kind of wanted to know like what your experience was moving to the US and how you were able to like assimilate and get into medicine and all of that.
Okay, yeah, I think that's definitely a really, really good one. So unfortunately, I am not the greatest representation of an IMG or for struggling IMG. I'm very, very sorry about that. I know that it is exceptionally hard for IMGs to get into programs, to get accepted, to get visas, to get opportunities to even come shadow and do electives. It is extremely hard. And I know that there's a lot of things that are changing right now with the USMLEs. I read that they canceled the CS exam just yesterday. Which is just crazy to me because I personally felt like that was a great opportunity to show your skills and it was kind of an easy pass for a lot of the IMGs too. So having said all of that, I think for me, my biggest goal was to reach out to as many people as I could. When I first got an elective in New York, I think I may have sent my application or my resume to maybe 700 people. And then 3 of them replied back to me. And then 1 of them actually worked out. So definitely don't feel disheartened. A lot of the people won't even read your resume or read your application, read your email. But I think that definitely worked for me was to just kind of reach out to as many people as I could. If you know someone, you know, y'all know me now, so just reach out to me. I'm more than happy to help whoever, send your resume, forward it. But if you know someone who's been part of the system, who's a doctor here, who knows anyone here, definitely reach out to them for sure. People are more than willing to help each other, especially in medicine. We're all in this together, so everybody helps for sure. I haven't met a doctor yet who's been like, no, I'm sorry, I'm not going to help you. So definitely do that. And then I would also recommend, you know, making your resume competitive because it is extremely hard. So put in a lot of research time whenever you have time, even in your school during residency. Affiliate yourself with programs of studies, with trials, put yourself out there. So definitely add a lot in your resume. And then just, you know, stay focused. If underserved medicine is what you want to do, then put in those hours and show it on your resume. Say, hey, I have 400 hours working at a community care center and I'm really passionate about that. So all those volunteer hours are great. For the longest time, I think for 9 months before I got my job at Baylor as a research trial coordinator, I worked there for free. So I literally just showed up and I said, hey, I'm really interested in research. I know you guys don't have a position open right now. I'm just going to work here. And they said, okay, I guess that's fine. And then 7 months later was when I actually got a job. So it was a hard time financially for sure, but I just sucked it up and I just did it for, I had a bigger goal. And I think definitely it's very, very hard, but just stay focused and clinical experience, research experience, putting yourself out there, meeting people, going over to the programs that you feel like have a higher chances for IMGs to match at. Go there. If there's someone in your med school that is matched at a particular program, definitely make sure to apply there, reach out to the program coordinator because they somehow know your med school, they somehow know where you're from, and just physically show up there and say, hey, I'm just here. I wanted to see if I could spend a day with your residents and just get to know y'all. They won't just turn you away. Even if they do, they will make a note that you're extremely interested, because that's one thing that I have over the last couple of years is seen during our residency process where, and one other thing, I think this might be good for some of y'all applying, but that email that you send after an interview saying, hey, thank you for your time. And a lot of us are like, no, I don't know. I mean, should I, or do they even care about it? Or is this going to be bad? No, it's very good. People definitely remember you. Definitely put in something that you thought was memorable, saying, hey, I enjoyed our conversation about serving underserved and I felt like we have similar goals and I felt like you would be a great mentor to me, or this was just great chat. And I'm extremely interested in your program because we talk about that all the time. I'm like, hey, she sent me an email. She says she's really interested. If she's interested, she's likely going to rank us. You don't want to rank someone who doesn't want to come to your program. You want to rank people who are crazy about your program. So definitely let them know, hey, I'm crazy about this place. I will do anything to be here. And then it's a huge thing. It's a positive for sure. So send that over to the residents you interact with, to the attendings you meet. It's very positive for sure.
Thank you so much for all of that. Great advice. Honestly, incredible. I think a lot of people needed that. That being said, just so we can wrap up, as we are hopefully, circling and ending this pandemic with the vaccine rollout, we're still, struggling with virtual everything, but is there any last piece of advice you want to give us as pre-med students navigating through this very weird time?
I know it is crazy. I think that it's all coming to this really humble, modest, a very well-deserved kind of an ending, which is just everybody's just left feeling like, oh my God, that was a hard year. And I think everybody is extremely sensitive to people around each other. They care. They know that it's been extremely hard. And I think more so than ever, people are open to have conversations, to put in the extra time to kind of get to know you. And because they feel like, yeah, this poor kid probably didn't get an opportunity to come see us or do an audition rotation or do an elective because nobody was seeing them. So I won't use the sentence take advantage of that, but I would definitely say that, leap in with your strengths, and kind of really just be a complete brat about it, where just don't stop talking about it. Say, hey, I have done so and so. I am so passionate. I've put in all my time and effort in all of this, because unfortunately the personality aspect is hard going through on virtual screens. So definitely it's kind of awkward, but just say, oh yeah, by the way, also I've done this and I've done that, and just kind of put yourself out there. I would definitely say that despite the fact that the opportunities are limited, they are still available. So don't stop reaching out to people, program coordinators, program directors, even other attendings, associate professors. saying, hey, I know that maybe we were taking 10 people in the past, and we're just taking 5 people now. Can I be one of them? I really, really care about this. And just the fact that you emailed them a few times would definitely be a positive factor too. So definitely don't stop, definitely keep going. If you didn't match this year, trust me, you didn't lose a lot. It is crazy. It's been crazy. The learning curve has definitely slowed down. Like all of the interns last year didn't learn anything except taking care of COVID patients. So it's just like when you left residency, you didn't know how to treat heart failure or hypertension or diabetes, and all you knew was COVID management. So then it's just kind of like silly. So think of it in a positive way. Just be positive, be optimistic, and then just don't give up. Don't stop like pursuing your dream. It will happen one day or another. I promise that it will. So definitely just keep going. Reach out to people, and then yeah, just that's all I would say. Honestly, I think I've seen a lot of med students the past year struggling, and I think in retrospect, I think it was better for them to not be a part of it. So while you're staying over this whole year at home, I think definitely a good idea would be to pick up courses, online courses. There's tons of research courses, there are tons of humanities, socioeconomic courses that really help your resume. So if you could pick up one of those, just do those. And then a lot of like volunteer opportunities, if you're able to pick up those, I think that would be a good use of your time, and it would look good on your resume too.
Great. Thank you so much for all of your advice. This was super informative, and thank you for really expressing how passionate you are about medicine and patients who really picked up on that. So